things that we're most proud of, I would say they're in two categories. Three categories. One is helping patients find information about health and wellness.
Okay.
So we partnered with the Mayo Clinic, as you may know, and they've developed some of the earliest forays of Alexa skills that are really about educating patients. And the most general use case is being able to answer questions about first aid, right?
Okay.
How do I treat a sunburn? What do I do if I have a spider bite? How do I remove a splinter?
Yep.
Basic things like that. So making the high-value healthcare content of somebody, a well-respected organization like the Mayo Clinic, available more broadly to a consumer audience, not just on their website, not just in mobile apps, but through this next generation channel. We have a number of examples like that, and I will say that was the first foray into voice. The next thing that we're doing is we're doing more in clinical settings. So we've recently deployed voice assistants at the bedside.
Okay.
Not in this country yet. We're actually doing this in Australia, where we've got applications where patients are able to communicate their needs through voice while they're in their bed in the hospital room and say, I need to use the bathroom, I need a drink of water, I need a blanket. And that information is sent to the on-call nurses. The nurses can respond through an application that allows them to decide who's going to respond and when, how important it is, what's the criticality of it. What's important is they know what the request was. So in contrast to the old red call buttons that you used to push,
Right.
which are very binary,
Right.
the nurses know exactly what the request is, and they can triage and respond accordingly. And we're seeing reductions in the response time on the part of the nurses.
Okay.
We're seeing reductions in things like risk of fall.
Okay.
And it's not as obvious, but you think about a patient who needs to use the toilet who has maybe a spinal condition or some other reason. If they get up and try to go to the toilet themselves, they're a fall risk. And
Okay.
anything we can do to reduce that is an important value metric. So that's second. The third one is more once a patient has received care and they're at home, right? How do you ensure that they're adhering to their treatment? How do you ensure that they're getting the support and help that they need? We're doing that more indirect through our partnerships. We're embedded in solutions that major providers are putting out there for caring for patients with chronic heart conditions,
Okay.
with diabetes, with respiratory ailments. So that's where we're sort of the behind the scenes enabler where we see real results.
Nate, are these software applications that are integrated with multiple Alexa skills, or is like the one, maybe the
Not
second
all of
one
these
you
are even
mentioned?
voice.
Okay.
The common theme here is a conversational experience. It could
Okay.
be a chatbot. The modality can be voice. It can also be chat. It can be touch and icon-driven interfaces, but it's basically a virtual assistant that's in conversation with you.
Okay.
So
Now-
that's what we power.